esteemed colleagues here, and we're just going to learn how to talk about the physical exam. Okay, now we're not going to do anything too invasive, no rectal exams, things like that. We're not going to expose other parts, no bleaching and things of that nature.
You did a rectal bleach?
But we're going to come over and join us. But we're going to just do a very basic
Yeah, I'm first.
All right. Now, one thing you want to do is make
Don't
sure
be scared. You want to teach me?
All right. Now I'm going, can you see? Okay, I'm going to have him sit up straight, like this, okay. Look at his, okay, the head shape.
Qué mala tu
Look
eres.
at the skin. Okay, look at the hair distribution here.
You
Okay.
got no hair now.
The ears and so forth, okay. Now I'm going to feel the back of the neck. I have to tickle now, right?
What are you supposed to be looking for?
This here is the, okay, does everyone see? This is the sternocleidomastoid muscle, which is here. And I'm going to feel behind this here, this muscle here. And right, and I'm going to feel in front of this because you have the lymph nodes which are here, okay, which should not be felt. So I'm going to have him go like this. I'm going to feel behind this muscle. Feel in front of the muscle here. Okay, now we also feel right above, right through his clavicular space here for lymph nodes. Okay, and I'm going to feel the neck right here, make sure the trachea itself is midline. I'm going to ask him to swallow. The thyroid gland is felt, it's not fixated, it's not enlarged. Okay, now I'm going to look at the face itself, the eyes, okay, look at the nose, the mouth, no drooping here, open up your mouth. Okay, and when I have,
Yes.
take a look inside, okay. 100 cavities, I'm sorry. Get your tongue out, okay. Lift your tongue out. Very good, okay. All right. Looking at the hard palate, soft palate, looking at the uvula, looking at the tonsils, looking at the tongue itself, looking at this buccal mucosa, so the pharynx, everything else, all that I saw which appear to be normal. Now, this here is called, well actually I'm going to do this.
What do you look for, swelling?
Swelling of the lymph nodes, when you have any lesions and so forth. I've seen patients have thrush, yes.
What happens if you have lymph nodes?
Lymph nodes are, this is a major part of our immune system which helps protect us. Unfortunately, infections and cancer cells can use them as a means of spreading. So if someone has a lymph node that you feel, and that is palpable and is not tender and tends to be on one side, that may not be a good sign. It may be more suggestive of cancer. If a person has lymph nodes that are swollen, both are involved, sides are involved, and it's very tender, that oftentimes suggests a person may have an infection. That's why if a doctor feels a person having lymph nodes that are swollen, they'll put them on antibiotics for 2 weeks, and if it goes away, there's more likely an infection. If it doesn't go away, it gets worse, then it could still be an infection, but more likely it could be something else more serious. Now, for some reason here that this is not working, I'm going to pretend. Okay, this is called an ophthalmoscope.
That one don't
Allows
work
you-
either?
No, that one works.
What is it?
See, normally what happens is that when you take these bolts off, okay, just plug them in. See, lights on here. Turn this on, and when you have one hanging like this one should turn on while this stays off. And when I hang this one should turn on. Okay, this is not coming on for some reason. So what you do is that this is the part that you just simply go and click on like so. And what you do is that when you look at the patient's eyes, make sure you keep both eyes open as you're looking. Now, when I look at his eyes, make sure he's looking straight across at the wall there. Now, please don't do this. Don't do this. Now, he's looking straight. Don't do this.
Wait,
It's
don't
not-
do what?
Yeah,
No, look at my face. Now, don't stand
That's
facing like this.
Yeah, that's
You're getting too close, right?
It is?
He might fall
If
for
I'm
it.
going to face like this, right, what can happen? Okay. He don't believe it. But instead, I'm what? Now he goes across. I'm on this side, right? Now, if the light was working, okay, I would be able to look inside his eyes this way.
So what exactly you were able
What you're
to
doing is
see?
that you're looking inside his eyes to see what?
Through the pupil.
Through the
talked about
pupils
this
to
last
see,
The lens.
right, to see what?
The lens.
What's it, okay, so the front of his eye is called what? The
Cornea.
cornea. Then it goes through what? The aqueous humor that hits what? You have that color part called the
The iris.
iris.
It's the
The center's called the pupil.
It's the
You
lens.
go through the pupil, and light enters what? Passes through what? Another what? Lens. Then you go to that big space called what? The vitreous
The vitreous.
humor or body. That red tissue on the inside is called the retina, which contains what photoreceptors?
Cones.
Cones and rods. Which ones let you see colors?
Cones.
Cones, right? And rods let you see what? At night? Okay. Which one's more sensitive?
Rods.
Rods. Okay. Okay. Rod, right? Rod. You're good. Now, what's behind the retina? That middle layer is called what? CH something. Choroid. And the white of the eye is called what? Sclera. Very good. So I'm going to look inside. I'll look inside his eyes, and I could adjust this to the different magnification levels to look inside. And what am I looking for?
Any blurry.
Okay, look at his retina, see if it's what, detached. How can I tell if his retina was detached? What color would it be? If I'll shine the light in his eyes, and I see what kind of reflex? Red or white?
White.
White. Red means what, off the what? Red what? Retina. But the retina what falls to the side, I'm looking what behind it, which is white. Understand? Or it could be what in a child? It could be what? Cancer, we said what?
Brown.
What's it called again in cancer involving the retina? Very malignant. Retinal what? Blastoma. Right, does that sound familiar?
Yeah.
Okay, so now, I would also, what I would do is that I would go and, while he's looking straight across at the wall, I would go like this and cover up his eye here. And what happens is, when I cover up his eye here, just one side of his eye, what will his pupils do? Pupils.
Darling.
Along with dilate.
If I cover up, okay, if the light was dim, his pupils will what? Will dilate or constrict?
Constrict.
Is the pupils doing this?
No, it's the iris.
Who's doing it? It's the iris, right? So pupils are the windows. The iris acts as the curtain that covers over what? The pupils. Does that make sense?
Yeah.
So we have what's called a reflex, okay, involving the pupils. So in other words, if one side constricts, the other side will constrict. Should they constrict at the same time? At the same size?
No.
They do, actually. Okay, it's called consensual light reflex. Why consensual? It means both sides what? Agree.
Agree.
So therefore, now let's say if I were to shine light in his one eye, one pupil got small, the other one remained large. That means what? There's a major problem going on. Or if his pupils were trying to what? Were trying to close, but they were like doing this, that's what? A major what? Problem. So he has a nice smooth closing of one pupil, and the other pupil also will close at the same size at the same speed. That means both sides of what? Are talking to each other. It means what? He has normal communication. Does it make sense? Now,
I'm sorry. How do doctors tell when they're intoxicated with drugs and stuff?
well, again, if you're going to be, it depends on the drug that one takes. Certain narcotic drugs are going to cause the pupils to become fixed and dilate, even in the presence of
They
light.
make them bigger.
Other drugs, opiates, can make the pupils like this pinpoint.
Yeah.
I mean, even though it's dark, it's like still like pinpoint, so you can kind of tell. Or sometimes, if you see the pupils are what are fluctuating, it could suggest a person's brain may be herniated. One time, a guy, 29-year-old white male, committed suicide. He shot himself in the mouth, and what happened? The nurse thought he was brain dead. He thought he was brain dead. When we looked at his eyes, his pupils one was fixed and one was dilated. One was both of his pupils were blown actually. And we looked at his nose, and I saw this clear discharge coming out of his nose. We thought he had a cold, what they thought. And I said, wait a minute now, it looked kind of grayish. That was his brain oozing out.
Wow.
Too much coke.